All right, let's talk a little bit about peripheral neuropathy. This is really just going to be an introduction, though, because there's so many conditions that can have peripheral neuropathy with them. And so a lot of the conditions will kind of come back to both in injury evaluation and treatment and in pathology for the conditions that can have peripheral neuropathy with them. So basically, peripheral neuropathy is when you have damage or irritation to peripheral nerves. You can have like this happen to one nerve at a time or groups of nerves, and this can be for a variety of conditions. You can have this damage from circulatory causes, from injury causes, from compression causes, lots of different reasons. It's very, very common. Like 20 million people, estimated 20 million people in the US have peripheral neuropathy. You're going to massage people with peripheral neuropathy for sure. And with the variety of different reasons why they have it, right? Some are quite common, like the different reasons that let's take a look at some examples. Here's some of the different types of examples. You can have injuries, whether acute or chronic, and that can be things like your carpal tunnel syndrome, your thoracic outlet syndrome, your trigeminal neuralgia, your Bell's palsy, like all different nerves that can get, compressed, irritated, damaged. You can have infections that irritate nerves. There were lively discussions about herpes zoster today, HIV/AIDS, whether the condition itself or some of the medications that treat it can also result in some peripheral neuropathy. Systemic diseases such as diabetes, renal failure, vitamin deficiencies. This is super common with diabetes, right? You're going to have lots of folks. Obviously diabetes is super, super common. You're going to for sure massage folks with diabetes. And we'll come back to that as a condition on its own. But one of the common symptoms is you'll see folks, especially with their feet and with diabetes, have like peripheral neuropathy with pins and needles and sensations in their feet. Other time, peripheral neuropathy can sometimes feel more like a heavy weight or a lack of sensation. And then of course, sometimes it can feel like the classic, sharp shooting pain or pins and needles, etc. Toxic exposures, including chemotherapy, but I give a shout out to alcoholism, over half of the folks with serious alcohol abuse end up with peripheral neuropathy. It's hard on the nerves. And if you have the new edition of the textbook on page 179, there's a great, in red in the section related to this, you'll see the conditions, a lot of the conditions here. So I will try to switch over to this just briefly with my document camera in case you don't have that. So this is not even an exhaustive list, but these are some of the conditions. We talked about a lot of them. So one of the things to keep in mind, right, is that undiagnosed signs and symptoms of, nerve pain, whether it's the sharp shooting or the lack of sensation or whatever, is a very good idea for clients to have that diagnosed to treat them safely and make sure they have, the best treatment. And some of these conditions, we can help quite directly. And those are the ones oftentimes like the compressed nerves, that we're going to study in IET or injury evaluation and treatment, like carpal tunnel syndrome, thoracic outlet syndrome, piriformis syndrome, things like that. In fact, we'll talk about and treat already next week thoracic outlet syndrome. So yeah, I'm going to switch out of this view. And are there questions so far while I do that? All right. And again, because there's so many different conditions that can include peripheral neuropathy. One of the things really to keep in mind is that, that we're keeping in mind whatever the underlying cause is, right? So if somebody has diabetes, we're going to be cognizant and aware of the things that we need to for diabetes. We'll study that again as a condition in itself, but one of the things to keep in mind with folks who have diabetes is that their wounds can heal a lot slower. And so we have any cuts and scrapes, and we don't want to cause any cuts and scrapes. And while we are avoiding all clients open wounds, we're especially careful with the immune compromised folks and folks who have slower healing. So that's one thing to keep in mind. Onset is often slow, but again, it depends on what condition this is accompanying. We can have that burning pain, we can have numbness, tingling, we can have more of a heavy sensation. Now, remember that nerves often travel bundled up with blood vessels, so we can oftentimes have vascular symptoms at the same time. So there might be a change in temperature, like a coldness. There might be kind of a bluish tinge to the skin, right? So we might have a difference in the blood flow at the same time, just because the nerves that are affected are often traveling with blood vessels too. Somebody might be especially like hypersensitive to pain or in lots of pain, right? Reduced sensation, numbness, this loss of balance, right? The risk of falling. These are considerations, right? If folks have peripheral neuropathy, particularly, obviously, especially with their feet and lower extremities, right? That might get to the point where they have less coordination, right? Also, kind of similar, but a little bit different. If there's a kind of a lack of sensation or awareness, or that kind of heavy kind of feeling, sometimes folks can injure themselves if they kind of are like kind of brushing themselves into things that they shouldn't, like edges of tables or whatnot, things like that. So sometimes if the motor nerves, and again, those are the ones that are sending the signals out from the central nervous system out to send signals for the muscles to fire. So if those are the ones that are damaged, we might also have twitching or cramps, atrophy, like we were just talking about with, ALS. And then in the lower leg, you can get sometimes what's called a foot drop. And so that's like in a walking gait, there might be like kind of typical walking gait. And then once in a while, one foot kind of drops. And so in the trying to step forward part of the gait, the foot kind of collapses. So sometimes it sort of happens irregularly or regularly, and that can be different conditions can have a foot drop with it, including multiple sclerosis, which of course can have nerve damage due to damage to the myelin sheaths. And MS, multiple sclerosis, is very common, and we'll talk about that as a specific condition itself. Questions so far?
No.
Thank you. So I was talking peripheral nerves, right? You can have damage to the autonomic nerves too. And so that can, those nerves are going to control our autonomic organs. And we can have problems with digestion, heart rate, respiration rate, blood pressure. I mean, obviously, these are things you'd want to get diagnosed, right? This can have different underlying conditions for this. So the treatments can vary greatly depending on the underlying condition. And again, in injury evaluation and treatment, we'll focus on the conditions that massage is particularly helpful for. And then otherwise, things where we kind of just help with, pain and relaxation, stress, and things like that. So, but some of the other, some of the conditions are treated with casts and splints, ointments, acupuncture, biofeedback, and movement exercises. Of course, there's a lot of different methods of doing that. The medications vary greatly, of course, depending on the underlying condition. Some of the ones mentioned here are the analgesics or the pain killers, anti-inflammatories, immunoglobulins, anti-seizures, and antidepressants. And so, of course, you always want to look at what medication the client is taking and seeing if that has implications for side effects or anything we need to be especially careful with a client on the table. Analgesics, a big one, if they're taking strong painkillers, if they're taking anything that interrupts the sensations to the central nervous system, that's interfering with them processing really how deep your pressure is or how big your range of motion is. And so you want to take everything down a notch and just be more gentle and more careful and rely more on what you're palpating than on client feedback. Questions on those? And again, if they have numbness or reduced sensation, we want to have a careful, conservative approach. It's best with undiagnosed pain to get, a diagnosis so it's clear really what's going on. And then occasionally, some folks might have extreme pain and not really be up for massage at that time. And you'll see that more in medical settings, right, than a sort of a general massage clinic where people kind of, self-select for that particular aspect. And then, even if it's a condition where massage doesn't cure or, improve the condition directly, oftentimes, we can help with that stress relief, soothing touch, parasympathetic nervous response. So any questions on this really big category of peripheral neuropathy?
Not from me.